Hi, I'm Dr. Nick Neneman with Neneman Chiropractic Clinic, and thanks for joining us again for another week in our video blog series. I got my skeleton friend here with me today. What I want to talk about this week is anatomy of the knee joint. Knee injuries are a very common problem. I see it here in the chiropractic office. A lot of times, though, more serious injuries, that require surgery, those problems are going to go elsewhere. But knee injuries are very common in sports. You hear about ACL tears all the time, MCL tears, meniscus tears. These are all terms, that people are familiar with. ACL, PCL, MCL, meniscus. People are familiar with these terms, but a lot of people have no clue really what they are or where they're located. So that's what I'm going to go over today. I'm going to go over anatomy of the knee joint and talk about the ligaments that support the knee. Go over them so you could see exactly where these injuries are taking place at in the knee. Alright, here we are looking at the knee joint. As we look at the skeleton here, we are looking at the front side of the knee. This is the left knee, looking straight at us. So here you can see we have the femur right here. This is the thigh bone, the femur that comes down, which is part of the knee joint here. From below, we have the tibia here, which is the major bone here that comes up. That is part of the knee joint. This skinnier bone here on the outside is the fibula, which is adjacent right next to the tibia. And then this bone right here is the kneecap, otherwise known as the patella. So these are the bones here that make up the knee joint. One of the most commonly injured ligaments is the ACL, also known as anterior cruciate ligament. It is a ligament that basically attaches inside the knee joint here. It attaches from the from the femur down to the tibia here, connects these two bones back deep in here in the joint, and it stabilizes the front part of the joint there. Then when you go to the back of the knee, you have what's called the posterior cruciate ligament, also known as a PCL, and this is a ligament that also attaches from the femur to the tibia and provides support more in the back part of the knee. Now on the inside part of the knee here, you have the MCL, also known as the medial collateral ligament, and that ligament goes from the femur bone, the inside of the femur bone here, down to the inside part of the tibia and stabilizes the inside part of the knee. When you go to the outside part of the knee here, you have what's called the LCL, also known as the lateral collateral ligament. That attaches from the femur here, and it runs down the outside, and it actually attaches here to the fibula bone. And that provides stabilization to the outside of the knee. So those are the four major ligaments that support the knee. And so a lot of times, in a sports injury or any kind of traumatic injury, when you hear about a tear, it's to one of those four ligaments. Usually the most common are the MCL and the ACL. The MCL here and the ACL inside here, those are the two most common injuries. The ACL injury is the most severe. That's when you'll see a lot. When that tears, you'll see the tibia, it'll shift forward. It'll really shift forward, a lot of instability with the knee joint in that injury. The last thing I'll mention are the meniscus. You always hear about the meniscus of the knee. That is, the meniscus is the fiber cartilage to the knee. You have the medial meniscus, which medial means inside, and then you have the lateral meniscus, which sits out here, which is the lateral or the outside part of the knee. So it's the medial meniscus is fibrocartilage that cushions the inside part of the knee. It sits between the femur and the tibia. Then you have the lateral meniscus, which again is fibrocartilage that is a cushion between the outside part of the femur here and the outside part of the tibia here. So when you hear about a torn meniscus, it's essentially torn cartilage. And basically you won't, when that tears, you won't have as good of support or padding or cushioning in between those bones there. Those are the major players. One other thing I can mention is the patellar tendon. Here's the kneecap, the patella. The patellar tendon is a tendon that runs from the patella bone here down to the tibia. That's another tendon that can become injured. Then, also up here from the femur down to the patella, you have your quadriceps tendon that runs through there. That's also a supporter of the knee. And I could really go on and on. There's a bunch of other, muscular tendon attachments to the knee that provide support, but this pretty well covers the anatomy of the knee. Well, there you have it. That's the anatomy of the knee for you. You should have a better understanding now of the ligaments and the cartilage that are part of the knee joint. Join us again next week for another great video blog. Hope you have a great rest of the week.